Mecklenburg County has a long and respected history of creating and implementing successful approaches to serving children and families. As such, Mecklenburg County Department of Social Services Youth and Family Services Division developed and implemented an online reporting system to aid various professional groups when making the right call to report allegations of abuse, neglect, and dependency.
At the conclusion of this training, educational personnel will be able to identify and respond properly to situations which meet the definitions of abuse, neglect, and dependency, understand his or her role as it relates to advancing racial equity, understand how to use the YFS online reporting system to report allegations of abuse, neglect, and dependency.
This video will provide an overview regarding Youth and Family Services Practice Model, Values and Beliefs, Child Protective Services Intake Process, legal definitions of a juvenile caretaker, abuse, neglect, dependency, and abandonment, your role in reporting allegations of abuse, neglect, and dependency, and an analysis of the data. Child welfare systems throughout the country are strengthening their approaches to practice as a means to improve outcomes for children and families. Youth and Family Services developed a well-defined child welfare practice model to build upon our strengths and continue to move from good to great in our daily practice and service delivery. The following values and beliefs guide the way we work with families, youth, and each other. We believe in family, child, and youth-driven practice. All children and families have the right to have a say in what happens to them and will be treated with dignity and respect. We believe how we do our work is as important as the work we do. The people who do this work are our most important resource. Children and families deserve trained, skillful professionals to engage and assist them. We believe all children and youth deserve a safe family environment. Child safety comes first. Every child has the right to live in a safe home. Ensuring safety requires a collaborative effort among family, agency staff, and the community. We believe children and families have the right to be understood within the context of their own family culture, traditions, and history. Children and families deserve skilled professionals who seek to understand their unique racial, linguistic, ethnic, and family culture. We are committed to aligning our system with what is best for children, youth, and families. The team process values multiple perspectives, and a team is often more capable of creative and high-quality decision-making than an individual. We are committed to working across agencies, stakeholder groups, and communities to advance racial and ethnic equity and improve outcomes for all children, youth, and families served. All stakeholders share responsibility for child safety, permanence, and well-being. As a system, we will identify and engage stakeholders and community partners around our practice model to improve services and supports. Now that we discussed the practice model values and beliefs, we will take a closer look into the CPS intake process, starting with our general statute which governs our social work practice. North Carolina General Statute 7B-101 requires any person or institution who has cause to suspect that any juvenile is abused, neglected, or dependent, or has died as a result of maltreatment, to make a report to the County Department of Social Services where the child resides or is found. In accordance with General Statute 7B-101, all individuals within the state of North Carolina are mandated reporters to include professional agencies such as law enforcement, medical offices, hospitals, and schools. As mandated reporters, any individual, to include professional employees, are required to report suspected cases of abuse, neglect, or dependency by any adult entrusted to care for the juvenile, such as a parent, guardian, custodian, or caretaker.
Child Protective Services referrals of suspected abuse, neglect, and dependency are limited to when the juvenile's parent, guardian, custodian, or caretaker caused, contributed to, or allowed the conditions or actions to occur. You may ask yourself what constitutes abuse, neglect, or dependency. The statutory definitions of a juvenile, caretaker, abuse, neglect, dependency, and abandonment serve as a guide regarding if a report is required. It is imperative all individuals are familiar with the legal definitions. Mandatory reporting in North Carolina includes everyone, not just professionals. All individuals are to report if they have cause to suspect a child is abused, neglected, or dependent. You may have your own idea regarding what behaviors constitute child abuse and neglect. You may observe a child with facial bruises, broken teeth, and/or injuries and conclude that the child is a victim of child abuse. You may have knowledge of a child in your school who appears to be underweight and possibly malnourished. He or she frequently appears dirty and often comes to school tardy. You may wonder what kind of parents does this child have. Perhaps this is a dependent or neglected child. The North Carolina General Statutes defines for us whether or not the child is an abused, neglected, or dependent juvenile, and who the responsible adult is based on the caretaker definition. We need to know the legal definitions so that we don't make decisions based on our own personal values or frame of reference, nor do we want to unnecessarily interfere with the lives of children and families in Mecklenburg County. Let's take a closer look at the definitions. A juvenile is any person who has not reached the person's 18th birthday and is not married, emancipated, or a member of the Armed Forces of the United States. A caretaker is any person other than a parent, guardian, or custodian who has responsibility for the health and welfare of a juvenile in a residential setting. A parent, guardian, custodian, and/or caretaker may be listed in the referral or CPS report as the alleged perpetrator. Allegations of abuse include physical and sexual abuse, moral turpitude, human trafficking, emotional abuse, cruel or grossly inappropriate behavior modification. Allegations of neglect include improper care, improper medical care, improper supervision, domestic violence, injurious environment, substance abuse, improper discipline, illegal placement, adoption, and dependency. Dependency implies the child or children do not have a caretaker present. Abandonment implies the parent left the child without a clear plan.
Human trafficking is defined when a caregiver recruits, harbors, transports, provides, or obtains another person by any means to be held in involuntary servitude, labor-related, or sexual servitude. We obviously don't have the right to get involved in the lives of families because we don't like the way they are raising their children. We may not agree with a parent's method of discipline, the food they provide for their children to eat, or the clothes they dress their children in. However, we only become involved with the lives of families and children when a report has been made to the local DSS agency alleging abuse, neglect, or dependency of a child. A referral, also referred to as a CPS report, is made to DSS YFS via the online reporting tool or by calling 980-31-HELPS or 980-314-3577. The referral is received and processed by a trained intake specialist. A two-level review occurs between the intake specialist and a supervisor or manager to decide whether or not to accept the referral for further investigation. The screening decision is based on what the law clearly defines as constituting child maltreatment. In situations when the allegations constitute a screening, the referral or CPS report is sent to case assignment, in which the referral is subsequently assigned to a child welfare specialist. In situations in which the allegations constitute a screen-out, the referral may be recommended for outreach services. Upon receipt of the referral or CPS report, the child welfare specialist responds to initiate the referral based upon one of the following response times: immediate, which is 0 to 2 hours, 24 hours, or 72 hours. Should you believe a child or children are at imminent risk of harm which warrants an immediate response from DSS YFS, we recommend you contact the helpline 980-314-3577 or 980-31-HELPS to complete a CPS referral versus utilizing the online reporting system.
As educational personnel, you play a key role in impacting the lives of families and children. As such, your ability to recognize signs of abuse, neglect, and dependency allows our agencies to collaborate and share a mutual responsibility for child safety, permanence, and well-being.
It is often misunderstood by the public when DSS can and cannot intervene. The law is very clear that certain conditions must be met before DSS can intervene with a family. Before making the decision to contact Child Protective Services, law enforcement personnel must assess if all three conditions are met. The following information must be included when making the CPS report: name of victim child, name of siblings residing in and out of the home if known, date of birth for all children, mother's name, father's name, other adult caretakers residing in the home over 18 years old, name of the alleged perpetrator or suspect, and address. The report must include if the perpetrator has access to the child or children and the reason the reporter is calling. Additionally, the report must also include where the child is located at the time of the report and when and where the alleged incident occurred.
Should educational personnel have cause to suspect or determine a child has been exposed to abuse, neglect, dependency, or abandonment, they must complete a Child Protective Services referral via the online reporting system or by telephone. Should you believe a child or children are at imminent risk of harm which warrants an immediate response from DSS-YFS, we recommend you contact the helpline 980-31-HELPS or 980-314-3577 to complete a CPS referral versus utilizing the online reporting system.
Racial equity and inclusion is the center of the YFS practice model. Now that we reviewed the intake and online reporting process, let's take a closer look into the REI data. In child welfare cases across the country and in Mecklenburg County, African American children and other non-white children have disproportionate contact with the systems designed to address child abuse and neglect. The disproportionate outcomes for African American children and other non-white children begins at intake and continues through the child welfare system all the way to permanency planning. If you happen to be an African American child residing in Mecklenburg County, you are 7 times more likely to have a Child Protective Services referral called in on your family. The data also indicates African American children spend almost 70 days longer in foster care than their white counterparts.
In 2019, Black children comprised 33% of the general population under the age of 18 in Mecklenburg County. Although Black children only comprise 33% of the general population, Black children are accounted for 41% of screened-in referrals, 45% of substantiated investigations, 50% of children entering custody. The data analysis indicates children of color are 4.24 times more likely than white children to receive a screened-in CPS referral. Additionally, 15 white children per 1,000 in the general population receive screened-in CPS referrals compared to 64 children of color per 1,000 in the general population receiving a screened-in CPS referral. In Mecklenburg County, the 5 primary reporting sources for a Child Protective Services referral are 1. Law enforcement personnel or court personnel, 2. Other, family or friends, 3. Human services personnel, 4. Educational personnel, 5. Medical personnel. According to the data from fiscal year 19, in Mecklenburg County, educational personnel served as the reporting source for 2,526 referrals, which equates to 13%. The data from fiscal year 20 indicates educational personnel served as the reporting source for 1,740 referrals, which equates to 11% of referrals in Mecklenburg County. Educational personnel reported 31% less cases from the previous year. We began to see a sharp decline in cases reported by educational personnel when school closures went into effect in March 2020. Highlight: this graph looks at the total number of cases reported at the intake level. This is based on number of reports or families. In the next slide, we will look at number of children in completed investigations. According to the data from fiscal year 20, in Mecklenburg County, educational personnel served as the reporting source for 2,699 children in screened-in investigations, which equates to 19% of the total number of children. Human service personnel accounted for 1,868 of the screened-in children, which is 13% of the total number of children in completed investigations. Educational personnel is the second highest professional reporter source for completed investigations in Mecklenburg. The other category listed in the table includes several non-professional reporters, such as anonymous, relatives, non-relatives, parents, and victims. In fiscal year 19, educational personnel served as the reporter for 20% of all investigated cases. The decrease in fiscal year 20 is likely due to COVID-19 related school closures. The size and population of Wake County, North Carolina, is most comparable to Mecklenburg County, North Carolina. Although these two counties are similar in population volume, the recent data indicates educational personnel in Wake County served as the reporting source for 1,803 children in completed investigations. That is approximately 33% less children than in Mecklenburg County. You may begin to ask yourself, what is the true analysis of this data? Disproportionality starts at the front door. Black children are disproportionately represented in the child welfare system. We saw earlier that in 2019, Black children made up 33% of the total number of children under the age of 18 residing in Mecklenburg County. Here we will take a look at completed investigations reported by educational personnel. In fiscal year 20, 44% of the children in completed investigations reported by educational personnel were Black. In contrast, 10% of the children in completed investigations reported by educational personnel were white. This data reflects educational personnel within Mecklenburg County, our second highest source of reports for children with completed investigations. As professionals, educational personnel currently have the option to utilize the online reporting system to complete Child Protective Services referrals. As such, we want to ensure referrals submitted via the online reporting system do not result in an over-reporting of African American children and non-white children in Mecklenburg County. As professional reporters, providing accurate race information at the time of the report allows YFS to track information about the children served and measure outcomes. Incorporating a racial equity lens allows professionals to be aware of their own biases in an effort to remain open-minded and demonstrate an understanding of the family's culture.
In alignment with Mecklenburg County's Racial Equity and Inclusion Framework, the Youth and Family Services Division developed action steps to incorporate racial equity and inclusion as the foundation to our social work practice. Intake and assessments serve as the first two service areas which incorporate REI. One of the practice model outcomes is to increase the amount of kinship options for African American children at initial placement. A comprehensive case record review aims to enhance family search and engagement efforts and effective use of CFTs. The Policy and Practice Model team oversees YFS divisional policy and procedural development. YFS incorporates policies which focus on thoroughly reviewing kinship providers' child protective service history and criminal background. The goal of the policy is to assess kinship providers and no longer allow their criminal background to be the primary cause for denial. This policy further promotes a family engagement lens and provides a second opportunity toward ruling an extended family as a kinship placement. YFS developed a REI training to help staff recognize their own implicit biases and discuss overall system issues leading to disparity. The REI committee continues to raise awareness of our REI Foundation by facilitating community meetings with our professional agencies who account as the primary reporting sources.
Next, we will cover some technical tips on how to navigate the online reporting system by creating an account and submitting an online Child Protective Services report. Go to the online reporting website and click on Sign Up/Sign In the top right-hand corner of the screen. Then click Sign Up Now at the bottom of the screen. Follow the steps written on the page. Once your account is created, sign in and complete the reporter information. This is where you will need your business code. The business code for educational personnel is CPSEP20. Once you have completed all necessary reporter information, you can add the CPS report. Click Add New Report on the screen. Accept the notice of terms and click Save and Continue. As a security feature, after 15 minutes of inactivity, the system will automatically log you out of the system. Also, if you do not complete and submit the report within 2 hours, the report will be automatically deleted from the system. When completing information for a report, any area with a red asterisk is a required area and must be completed before proceeding to the next section. When looking at the report, there are 5 tabs at the top of the report. The title of these tabs are Reporter, People Involved, What Happened, Strengths and Safety Concerns, and Maltreatment Guide. Each tab has specific mandatory questions that will need to be completed before proceeding to the next tab. On the People Involved tab, you will need to click on each section to input the necessary information. These sections are titled Children Information, Parent Information, and Caretaker or Other People Involved. It is in these sections where you will input the names and demographic information of the family members. The process to add individuals to the report is you must click Add first and then complete the necessary information before clicking Save. After you put the family's address in under one person, for each additional person who resides at the same address, you can select the address from the drop-down, which will save you time when completing demographic information. The What Happened tab is where you will record all of your concerns about the child and/or family. After typing out the narrative, which will include most of your concerns, there are additional mandatory questions you will need to answer. Remember, these questions will be marked with a red asterisk. On the Strengths and Safety Concerns tab, there are mandatory questions you will need to answer in order to proceed. On the Maltreatment Screening Guide, if you check any of the maltreatment categories, then the system will automatically populate additional questions that are related to that category. These questions are not mandatory, but will help to provide additional information to the child welfare specialist who processes the report. After you finish completing all of the information, you can view the report summary. Make sure to read the notice on the screen and then click Submit. Once you submit the report, you will get a system-generated email indicating the report has been submitted and you will receive the e-report number. Please remember, the online reporting system is a way to submit non-urgent Child Protective Services reports. If at any time you believe the child is in immediate danger or will need a quicker response, you will need to call the helps line at 980-31-HELPS or 980-314-3577.
Mecklenburg County has additional resources in place to further support children and families.
Mobile Crisis Unit is a mental health service which supports the community by providing immediate response emergency mental health evaluations. Should you be involved with a family and you believe an adult or child is experiencing a mental health crisis, you may contact Mobile Crisis at 800-510-9132.
Mandated reporters may provide families the Safe Alliance Hopeline number. The Hopeline offers information and services for parent support, domestic violence, and sexual assault. All mandated reporters may contact Mecklenburg County YFS CPS Intake at 980-31-HELPS. That's 980-314-3577 to report suspected abuse, neglect, or dependency. Professional mandated reporters may also report suspected abuse, neglect, and dependency via the online reporting system. Should you believe a child or children are at imminent risk of harm, which warrants an immediate response from DSS-YFS, we recommend you contact the helpline at 980-31-HELPS to complete a CPS referral versus utilizing the online reporting system. North Carolina state law requires that all counties provide child protective services to ensure that children are safe and that their basic needs are being met. For additional information regarding child protective services, visit mecnc.gov and select the DSS homepage. For general inquiries about child protective services, existing cases, social workers, and community resources, you may call Youth and Family Service Information Assistance Line at 980-314-7700.